On sciatica. Sciatica is basically the irritation of our sciatic nerve. I will insert an image of the sciatic nerve, but essentially it is our body's largest nerve and one of the most important ones. It branches all the way down from your spinal cord through to your hips, your bum, and branches down each leg all the way to our toes. So to simplify it, basically the sciatic nerve controls all of our leg movement and our ability to feel our legs. It's pain that can vary from moderate to severe. You can feel it in your lower back, so more so in the lumbar region of the spine, in your bum, all the way down your legs, so in your thighs and your calves. You can feel this pain at any point along the nervous pathway. Essentially, when this nerve is irritated, you'll get pain and what is called sciatica. Sometimes this pain is so intense that it feels like an electric shock. However, it could also just feel like a numbness or a weakness there. A symptom that has been talked about quite a lot is having pain in one area of the leg, but then having a weakness / numb pain in the other part of the leg. Sciatica will also normally be on one side of the body. And that pain can intensify if you cough or you sneeze or you suddenly move, or if you're sitting down for a prolonged period of time. There's several conditions that can cause sciatica, but all of these conditions will affect the nerves in your spine and your lower back. It will also normally relate to the sciatic nerve being compressed or pinched. So first one that springs to mind is when you have a slipped disc in the back that compresses the nerve. You could also have something which is a lot more rare, but it could be when a tumour or a disease like diabetes, for example, compresses the sciatic nerve. Another condition could be having an outgrowth of bone or a bone spur in your vertebrae, and that could also compress the sciatic nerve. You could have a particularly narrow lower spinal canal, and that will in turn put pressure on your spinal cord and your sciatic nerve roots. That is something which is called spinal stenosis. There's also such thing as something which is called piriformis syndrome. So I will also insert a picture of your piriformis, which is a muscle. Piriformis syndrome is basically a rare neuromuscular disease in which your piriformis will involuntarily contract or tighten, and that causes sciatica. Your piriformis basically connects your lower spine to your thigh bone, so it's an important muscle, and it can affect your sciatic nerve. So risk factors can first of all include your career. So if you're in a career that is basically placing a lot of strain on your back, either through sitting down for a long time, carrying heavy objects, or sudden twisting motions, then that can be linked to it. If you have heavy diabetes, this can increase your risks of nerve damage and sciatica. Also, if you have problems with the discs in your back. Smoking is a risk factor because it can actually cause the outer layer of your spinal discs to break down. Also, the older you get, the more likely parts of your body are to break down, so age can contribute. So there's lots of different diagnosis techniques to detect sciatica. First of all, it might be a physical examination to see what movements are causing your pain. Second of all, obviously the sciatic nerve is a nerve, so we can detect nerve impulses, and therefore we can learn of its abnormalities and locate the area involved and the degree of which the impulse is being slowed. X-rays and imaging scans, etc., will also help to give an insight into your spine, and what is going on in your back can in turn determine your causes of sciatica. So there are lots of different treatments to treat sciatica. This can either be from home or in terms of surgery. First thing is to apply cold or ice to it. You could do this through an ice pack or frozen vegetables, for example. Basically, wrap the ice in a towel, apply it to the affected area for around 20 minutes per day. Do this in the first few days of pain. This will basically help to reduce swelling and ease pain. After the first few days of pain, it's more recommended to use heat instead. It is really important that you try to continue exercising and your activity levels stay the same, just because if you try and lie in bed and avoid it, then actually your low activity levels can worsen its effects. Stretching can also be very beneficial, so always stretch out your lower back and your lower legs, of course. There is a video on my sports therapy page about stretching, and there's lots of different stretches in there that will concentrate on your lower legs and your lower back. Over-the-counter painkillers can actually make a difference as well. Regular exercise is definitely really important because exercise produces endorphins. Endorphins are our body's natural painkillers. At first I would stick to like low impact activity like swimming or cycling. As your pain decreases into your training program, I would definitely incorporate core strength training and aerobics. This will in turn basically help to reduce your chances of back pain issues in the future. Prescription medication can also make a difference, so things like muscle relaxers, antidepressants, narcotic pain relievers, and what these will do is basically increase your endorphin production. Epidural steroid medication. This is basically when corticosteroid medication is injected into what is called the epidural space. This is the canal which surrounds your spinal cord. This is very limited because of some of the side effects it has, so try to avoid that. Surgery will be given in really extreme situations. So for example, if you've lost control of one of your lower limb muscles, there's different types of surgery, but essentially what they will do is remove discs that are putting pressure on the sciatic nerve. However, alternative, so for example, you could go and see somebody who is specialised in acupuncture. Acupuncture is when needles are used. They are put at key points to affect the flow of energy in your body. The procedure is virtually painless, so it does sound a little bit scary. They want to see a chiropractor. They will specialise in manipulating your spine and your back to achieve like maximal spinal mobility. You could try hypnosis, or you could see a massage therapist who will like apply motion and pressure, tension or vibration on your body to relieve pressure and pain basically. So to finish off the video, I'm going to give 3 tips to prevent sciatica in the first place. This would first of all be to exercise often. Strengthening your back muscles, your stomach and your core are basically key to maintaining a healthy back. 2 is to mind your posture. So when you're sitting down, basically make sure that you're using a chair which offers the correct support for your back, that your feet are on the floor, you're upright, and if there's something like an armrest, always use it. Number 3 is to mind how you move. So when you're lifting heavy objects, make sure that you're doing it in the correct way. So for example, when you're lifting heavy objects, make sure that you do it correctly by bending your knees and keeping your back straight.